All right, so hi, my name is Audrey, and I'm here representing ASWCU Issues and Forums. So we are an ASWCU committee that strives to promote civil discourse and discussion through platforms accessible to our WSU community. The program today is brought to you by our committee chairs, Reese Chapman, Emma Taylor, and Jelani Christopher. So today we will hear from a number of students, some student leaders about COVID-19. You will get to meet ASWSU Vice President Sean Doster, ASWSU Director of Health Patrick Johnson, and ASWSU Director of Safety Sam Gerlach. You'll also hear from Megan Gold from Panhellenic Council and Sigma Phi Epsilon President Jared Holstad. So our program will also include a Q&A. You can ask questions under the Q&A tab and either address your question to a specific panelist or the whole panel. After the panel has presented, your questions will be answered in the following Q&A session. So you might be wondering why we're here today, why we're having this discussion. Well, we're here because we care about this community. And as students, we want to ensure the health and well-being of every student on campus and every individual in the Pullman community. Recently, Pullman has struggled. Prior to August 20th, when a majority of students returned to Pullman, Whitman County had reported 138 positive COVID-19 cases since March. If averaged, that means there are about 28 new cases each month. So now we can look at this past month. As of today, there are 1,212 positive COVID-19 cases in Whitman County. This means that in just 1 month since students have returned to Pullman, we have added 1,074 new cases, growing the previous amount by about 9-fold. By September 7th, Pullman was ranked first on the New York Times list of US cities with the fastest growing number of COVID-19 cases relative to population. The National Guard was sent to Pullman, and Governor Inslee even came here to speak to community leaders about ways to improve our current epidemic. Rapidly increasing rates could mean bad news for our healthcare system here in Pullman. Pullman Regional Hospital is small. It doesn't have the capacity to treat a large number of patients and only has 25 ICU beds. If COVID cases continue to spike, our community members will be put at even greater risk. Although many students are not at risk for needing intensive care, we must remember that our community includes individuals of all different ages and levels of health. When we spread cases, we are at risk of spreading COVID to a community member in a high-risk population. I realized that was a lot of numbers, and numbers are something we hear about constantly from media, from administration. But as you all know, Pullman is more than a ranking on a list or a COVID statistic. We call Pullman home for a reason. We have an incredible community here. But in the way we are headed right now, this community will not last. Sharing a cup of coffee at the daily grind or taking home a giant Stubby's glass are now only memories that our newest Cougs will never experience. Going to football games, walking around campus, and hanging out in large groups of friends are integral aspects of this community. I came to WSU for my education, but I stayed for the community and the experience. I miss the games and walking around campus and hanging out with my friends. I am sad that this semester, ASWSU Issues and Forums is unable to hold in-person events during a crucial election. I want to be able to share these experiences and opportunities with the people in this community. And if we do not work together in the coming months, we will be online next semester as well. We all love this community, and it is our responsibility to take care of it. Our student leaders here today have taken that responsibility upon themselves, and I will now share with you the privilege of listening to them speak. Please welcome ASWSU Vice President Sean Doster.
Well, thank you, Audrey, for that introduction. I think you did a really good job of just kind of laying out the stakes of what's happening right now in our Pullman community. So I wanted to start off tonight for my portion of this panel talking about what are we going to do about it? How are we going to kind of stop the spread of this virus in our community? And I'll be blunt with you guys, since this is a student panel, it's something we can do. Pullman's only going to be as strong as our weakest link. So at the end of the day, it's going to be on every one of us to take some personal responsibility for the well-being of our community. I'm not here to shame any of you for going out or seeing friends or even actually testing positive for COVID. This is month 7 and I'm getting a little bit tired. I'm sure you all too, all are too. But what I'm here today to ask you to do is, going forward, be an active bystander. You know, if you see people breaking the rules, say something, speak up. You know, you don't have to be going out to these large gatherings. Keep your keep your social circle small, and really be conscious of who you're interacting with. You know, if not for the good of yourself and your friends, just for the good of the community at large, as Audrey said. And I know it's hard, but quite frankly, it's what we're going to have to do to have any semblance of normalcy going into the spring. As I'm sure many of you know, the university said they are announcing what their plans for the spring are going to look like here in October. And as cases continue to rise in Whitman County, I can tell you, if I was one of the people making those decisions, I would not be encouraged by the numbers we're showing right now. So it's time for us to take some personal responsibility and really create some of that positive peer pressure in following the rules. But I don't want to be all doom and gloom today. What I really wanted to touch on is mental health during COVID-19. I know that a lot of you tuning in today are from MGC, IFC, or Pan-Hellenic. Lean on your brothers and sisters during these hard times. People are going through a lot right now. Just check in on each other, be available to listen, and have some of those tough conversations. I just want to recognize the overwhelming sense of loss that many students have experienced this semester and before we started this fall, from something as serious as the death of loved ones to maybe something more trivial in comparison, like the loss of Cougar football Saturdays and the classroom atmosphere. So I did just want to say, please know that there are resources for you at cougarhealth.wsu.edu that are free to access. Cougar Health Services is hosting a Thursday speaker series called Real Talk Thursdays. Those cover a variety of mental health topics, if that's something you might be interested in. Resources on their website also include tips and tricks on stress and time management, staying connected, depression, anxiety, and physical and mental wellness. You can also text @stress to 73940 and get personalized stress management tips from Cougar Health Services. I'm signed up. It's really cool, super helpful, kind of gives me a reminder to practice some self-care, which is super important nowadays. All of these resources are free and paid for, but with that said, we recognize that a lot of students find mental health services sometimes hard to access or maybe lacking in scope. So as one of your student representatives, I can tell you that this is at the forefront of our conversations with university administration. Campus-wide, there's a big buy-in on mental health and making sure students have the resources they need. Just know that you're not alone and that there's a network out there that that you can connect to. Again, I just want to reiterate, it's okay not to be okay right now. The last thing I wanted to touch on is a little bit about how you can get involved in making a difference on campus this semester, particularly pertaining to COVID-19. Through ASWSU, you can join an ASWSU executive committee. For example, the health committee, they'll be doing COVID-19 work. You could join the communications committee that has been doing a lot of our ASWSU COVID-19 communications. There are also a university committee applications available if you're interested in tackling some of these issues on a university-wide scale, and some of the implications of COVID-19 outside of, maybe health, for example, academic implications. You can find more information on both these opportunities in the link of the @ASWSU Instagram account. And while you're there, go ahead and follow at ASWSU for some more involvement opportunities and critical information. Finally, I just wanted to speak directly to any first year students that may be listening. And we haven't forgotten you and we'll continue to advocate for you. COVID-19 has thrown a loop in your education from the back end of your senior year of high school to the beginning of this year and going into the future. So be on the lookout for some more ASWSU resources. If you are a freshman or first year student, we care about you. Thank you all, and I'm really looking forward to answering some questions later.
Thank you so much, Sean. We're now going to hear from ASWSU Director of Health, Patrick Johnson.
All right, thank you all for being here. The turnout is great, so it makes me really happy that there's students here wanting to be engaged and learn about what's going on in the community. So my name is Patrick Johnson. I'm the ASWSU Director of Health, and I wanted to talk to you about a couple things today. So first, I just want to talk about what ASWSU has been doing directly for the students. So a lot of what we've been working on have been information campaigns, mostly targeting COVID. So I hope you've been seeing on the social media, we've been posting, testing requirements, costs, locations and times for students to try to get as many students as possible to be tested. And we've also been posting a lot of mental health resources on our social media, mostly related to COVID and the Suicide Prevention Week that just passed a couple weeks ago. ASWSU also does a lot of advocacy, both on campus in terms of being on committees. I think every ASWSU officer is on a bunch of committees just working to promote kind of the student perspective on issues. But then we also do advocacy in Olympia with the state legislatures. So we have a whole Cougar Lobby team that just focuses on getting WSU student initiatives talked about on the state level. We also do direct projects for students. So a big one we're working on right now are the Cougar Care Packages. These are for students that have been diagnosed with COVID, and it's just a little way to let them know that somebody's looking out for them, that's got some snacks, some helpful information, and some WSU swag. We just made the first batches of those, so those are gonna be going out shortly to students. The other thing I wanted to talk about is more directly related to COVID, and it's a couple topics that sometimes get missed. So I want to talk about why mask wearing, social distancing, and limiting gatherings will help us get back to normal in two ways. So the first thing I want to talk about is the infectious dose. So that's the idea that a single COVID or coronavirus particle is not enough to make you sick. You actually need about 1,000 to infect a person. Sounds like a lot, but it's not when you put it into the context that there's 200 million COVID particles in each person's sneeze. People shed virus over time, even when they're asymptomatic. And so that's why it's important to avoid those big situations where just by chance you'll be around somebody that has COVID without even realizing it. Masks help to block a lot of these particles from reaching you in the first place. And social distancing helps to keep those particles in the air and then fall to the floor away from your lungs and your body. The other thing I want to talk about is the infectivity of COVID. So there's this idea that everybody's going to get COVID, so why even try? But that's really not true. So infectivity is measured as the reproduction number, or the R0 value is what it's usually referred to. COVID's is between 2 and 6. And so what that means is that for each person who has COVID, on average, they'll infect between 2 and 6 new people. We can reduce this number quite a lot by wearing masks, reducing interactions with large groups of people, and maintaining social distancing. If we get this value below 1, that means that one person will infect less than one new person. And so eventually, over time, if you sustain that, COVID will essentially go away in the community in large part. It'll stop spreading on its own, and you'll just have a few isolated cases. And hopefully by then we can get back to some kind of normalcy and maybe be on campus. And I know we all want to. So with that, thank you.
Thank you, Patrick. That was super informative. We're now going to go to ASWSU Director of Safety, Sam Gerlach.
Hi, everybody. I'm Sam Gerlach, and thank you for being here and for actually caring about your community. Again, I'm the SWCU Director of Safety. And first off, I just want to thank everyone for their continued efforts to adhere to the social distancing and mask wearing guidelines, especially here in Pullman. I think the biggest factor here to consider is that the community cooperation is what's going to flatten this curve and reduce case counts. And that we can never forget we're a part of a bigger system here, and that's what really matters. And I really wanted to speak mainly on that because community aspect is my biggest concern here, and that's what makes the difference. And so I think right now I just wanted to talk about, like, from my personal experience, how COVID like changed my community back home and how those instances I think can translate better here. But the most valuable way I think I observed this was through my job back home, which is at a dental office. And so I'd like to share what I learned there and how that can benefit our community now. So we were seeing fewer patients every day, and we had new screening and sanitizing protocols that didn't allow us to do some of the same things as before. Like kids in the waiting room couldn't read a book or color, and most of the older patients just hovered near the door like they were perpetually ready to flee. But it was these little things, these little changes that allowed us to remain safer and have a better mindset about going into work or just going out in public every day. And people still kept coming despite these little changes. And people who felt safe to come outside again in May were more prompt to their appointments than before. And I think we hardly had any no-shows, which is really great. And I like that. And I think everybody liked that. But as to be expected, there are a few patients and some people who just don't want to comply with mandated mask requirements and that we were striving to enforce. But they were not very numerous and they're very far between, but they did happen. And I think Sean had it right by saying that we're only as strong as our weakest link. So as long as we follow to the best of our ability, everybody trying to look out for everyone else, that I think we can move past this. But again, back on the dental office, rarely we would ask someone to reschedule because of this, but sometimes we'd have to. You'd have to make those changes. And it was a new and awkward thing to say. It was nobody likes having to be rescheduled and nobody likes having to be confronted about the issue at hand, but breaking down that barrier and being honest with who you're dealing with and all the people that you're seeking to help and, enforce safety protocols for is what we need. I mean, it's not about being the most polite anymore, it's being about the safest. And of course, I'm going to talk about safety because I'm the safety director, but again, we would all do our best to ensure safety for ourselves and patients before anything else. And the people who follow the new protocols made working in healthcare feel not as unbearable as they made it on the news. Maybe it's just because it's a dental office and not a hospital, but I can't really speak on that. And what I can say is that it was the combined efforts of everybody in the community doing their best to self-quarantine and isolate, wearing masks and be mindful that allowed our numbers to remain as low as they did. And I continue to be grateful for everybody who followed those protocols and continue to follow those protocols and choose the safety of their community every day over just the slight inconvenience. And so I just want to thank everybody who is following those protocols for continuing to follow that. It's without people like you, without people just making the tiny sacrifice to wear a mask or maybe not see 20 people this weekend, like that's what's going to flatten the curve and that's what's going to keep our numbers low. And those small steps taken by the larger group will become much larger actions. Yeah, and I think the one thing I just wanted to update, branching off of Patrick, was that most of the people in Pullman right now who do have COVID are students, are in the age group 18 to 25. So we're assuming students, but it hasn't really transmitted to the community, which is great. And we're trying to keep that the same way it is. But just targeting this group of individuals and making sure that they know we'll all have to work together to end this, I think is our biggest concern right now. And yeah, I look forward to any questions you might have. Thank you.
Thank you, Sam. Now we're going to go to Megan Gold from Panhellenic Council.
Hi, everyone. My name is Megan Golden. I represent the Panhellenic community, Greek life here on campus. I oversee all 14 sororities. at WSU, and I'm really happy to be here today. First of all, I really want to say that IFC, who oversees the fraternities, MGC, who oversees the multicultural fraternities and sororities, and myself are working really hard to combat the issues that COVID-19 has presented to our community. Back in March, we all sat down and decided that we are going to extend our social suspension as a preventative measure to keep our students safe on our campus. We called this a core guideline. We came up with this way so that way students knew that it was preventative and we were looking out for their safety, and students were not in trouble, like somehow social suspension can have in previous contexts. This social suspension is to keep our students safe, and as a community, we want to work hard to ensure that this is upheld. A little bit about the core guidelines. The core guidelines were created in order to keep our community safe, and this means that we laid out social guidelines to make students safe to follow, all of course following the governor's orders. So 10 or less people, masks are required, 6 feet apart distance, so that way our students would know how to safely interact with people, so that way they could continue doing so in a safe and helpful manner, but also while still following the governor's orders and during this particular time. The core guidelines also states that chapters will be sent to GSB if they indeed violate the social suspension, meaning large gatherings, parties, social events that normally we think about when we think about Greek Row on our campus. These core guidelines were really set in motion by our chapter presidents because they were taking priority of our members to the utmost of their number one. They really wanted to make sure that the safety of our community was the number one thing that we were focusing on throughout not only recruitment, but through the rest of this year. Recruitment moved online virtually, and so that happened in August. That way we can ensure the safety of our members and our new members as well. Another thing along with CORE is contact tracing amnesty. This is a really big important part of it. Contact tracing amnesty is that if we hear about something that have happened or there's an outbreak within our Greek community, if contact tracing is involved and people are testing positive for COVID and we can backtrace, the chapter has a kind of like relief from any type of like things that could get them in trouble or be sent to GSB. We wanted to encourage this, that way if something was happening, that chapters would feel comfortable coming to us saying, yeah, that happened, here was who was at it, and here's who tested positive, so that way we could keep track of community guidelines better on our end. Safety and campus and the priority of the safety of our students on our campus is at the utmost priority. Time and time again, chapters have said how much they really want a testing site on Greek Row because our students want to get tested. They want to be the solution to COVID and not the problem. Students are constantly asking how they can isolate, what can they do to contact trace, what if they live with members. Specifically in the sorority chapters, our capacity was reduced because of sleeping porches, because our chapter presidents wanted to keep our students' safety at the number one priority again. This is something that we are stressing and really putting towards the chapter presidents, and something that they've asked for since March when this became an issue. We've had conversations throughout the summer with them and continue to have them throughout time here to see exactly how we're going to preserve the fraternity and sorority experience, but also make sure that we're keeping our members safe. That's what we care about the most. Cougs help Cougs, and that's what we're all about here in the Panhellenic IFC and MGC community. And we will continue to work together to provide the safety of our students and be the solution to this problem and not an ongoing issue. Throughout this time, we are always open to questions. We cut our dues back. We have shortened who lives in the chapter's facility. Some facilities have closed. Many dues have been reduced in chapters individually, as well as in the Panhellenic and IFC and MGC community. And we will continue to do the utmost that we can to protect our students, keep them safe, and preserve the fraternity and sorority experience.
Thank you, Megan. All right, now we're going to move on to Sigma Phi Epsilon President Jared Holstad.
Yes, thank you. I wanted to start out by thanking ASWSU Issues and Forums for inviting me to come speak today and share some of my experiences because I have a rather unique experience dealing with this. So like I said, my name is Jared Holstad. I am the current president of Sigma Phi Epsilon here at Washington State University. And I am a longtime Pullman resident. So I've lived in Pullman now for 21 years. My father started a business here in Pullman 37 years ago. My mother was a WSU graduate, as well as different members of my family, uncles and aunts, and my grandfather was a longtime employee of Washington State. As I'm sure many of you know, Pullman is a very special place. There's few things in this world that are more consistent than that feeling every August when you look out and you see the endless stream of cars coming into Pullman to help move in new freshmen to dorms. The students come back to refill their apartment leases for the fall, and there's that sense of excitement that fills the air. In the fall, on any given Friday, you can look out west on Davis Way, and you can see the stream of RVs and motorhomes as alumni return to Pullman to celebrate and cheer on our football team for Cougar Football Saturdays. During midterms and finals weeks, you can go throughout Pullman and on WSU's campus here, and you can look into any coffee shop or library and see it filled to the brim with students cramming the last minute for their finals and preparing to take their exams. But this year, like with most things in our lives, that hasn't been the case. This pandemic has greatly altered the way that we've been able to do things. And like Audrey and Sean both have already mentioned, this has had a major effect on the city of Pullman. Just today, it was reported that we hit our 1,200 case in Pullman. And this massive spike is mostly has occurred after the majority of the student population returned. On the good news of this, though, there hasn't been any deaths reported in Whitman County to date. And last update said there was just one current hospitalization, and I wish them a speedy and healthy recovery. The bad news is that death and hospitalizations are far from the only negative effect that this pandemic can have. Multiple Pullman businesses, including barbershops and coffee shops, some of which that have been Pullman staples in the community for a long time, like Cafe Moro and Daily Grind, have closed their doors indefinitely, unable to cope with the changes due to the pandemic. The massive spike in cases has also pressured local schools to be moved to entirely online learning for this semester. And that creates a whole new host of challenges. So my thoughts and prayers go out to the families of people with young children in the school system now having to try to balance the differences of either working at home or out of the house without now also having your children at home. And it's created a new challenge for teachers and administrators as well, trying to redesign how you teach education to the next generation of learners in our community. The Pullman community as a whole has done a tremendous job coming together to do what we can to support one another. That's something that I'm very proud of. It's been great to see people go out and continue to support businesses the ways that they can. It's been incredible to see the amount of support that the teachers here have received from former students as well as fellow faculty, encouraging them and providing praise where it's due for the excellent work they've been able to do to continue to provide quality education for the people in our community. Now, I think the pandemic itself has become rather polarized, and people's beliefs about the right and wrong thing to do and the severity levels are very varied. However, I think we can all agree on one thing, and that collectively we all want this to be over. As a college student, as well as an active member in the Greek community here, I understand the pain that a lot of you, my fellow students and Greek-like members feel. You feel like you've been robbed of an essential part of your college experience. We missed out on tons of fun events that are traditions that have been had in our community for decades, and it's a lot of things like Cougar Football Saturdays, homecoming week, things like that that we look forward to each year that we're not able to have this year. The good news about this, though, there is a sense of hope and a chance that we might be able to one day return to this normalcy. Things like increased testing, being proactive with contact tracing and isolation when you do get tested, as well as wearing masks in public spaces, all things that Patrick mentioned earlier here in the session, can help us keep the case rate low and can help us get us back to the lives that we want to live. Has the student response been great to the pandemic at WSU? Not yet. Like it was mentioned earlier, a majority of the cases that have been reported in Pullman and Whitman County have been from that student age population. We have systems, precautions, and guidances in place to help protect us and help keep our beloved Pullman community safe and continue to operate. I know this presentation is directed towards students, and I know there's bound to be a few business students in this conversation tonight. So I know you've learned about cost-benefit analysis. So cost-benefit, everything that you do, you can relate this to anything, but specifically with the pandemic, has a cost-benefit analysis to it. If you think about things like going out to support a local business, if you support and continue to abide by the current restrictions and guidances we have in place, there's a relatively low risk of you doing any damage going out and supporting these businesses. At the same time, you're providing a benefit for not only the business owners, but the Pullman community as a whole, putting money back into an economy that desperately needs it at this time. If you think about something, like going out to a party, a large gathering on the weekend, or jumping from a house to house, engaging with many people in a short period of time, there might be an immediate benefit, to the party or the person involved in these actions. But if you think about all the costs associated with that, you not only jeopardize your own health, but also the health of all the people you interact with, and then the health of the people that they interact with. Outside of health, this also increases our case rate numbers. It promotes the spread of this pandemic in our community, which ultimately will prolong the reopening and perpetuate a lot of the issues that I mentioned earlier that have been crippling our Pullman community. Like I mentioned, Pullman is a great community. It's a place that I've spent my entire life to date, and I'm very proud of the Pullman community, and we've been able to do a lot of great things. We have a saying, I know Megan mentioned earlier, that Cougs have said for decades now, it's Cougs help Cougs. It's this concept that as a WSU student or alumni, you're going to do what you can to help benefit other students and people involved with the Washington State University. In the city of Pullman, we have another saying that's put out. It's called Pullman Proud. It's things that our Chamber of Commerce has put out to help drum up pride about things that our community has been able to do. And I think it's time for us as WSU students and Pullman residents to combine both of these ideas. It's time for us as Cougs to help the city of Pullman, to do things that we can to make sure that we keep our community safe so that we can return to some sort of sense of normalcy. And when we do finally reopen, we don't have to suffer as many of the losses of things like businesses and lives in our community. And then hopefully at that point, Pullman can once again be proud of us Cougs. Thank you.
All right, thank you, Jared. So I believe now we might be going into Q&A. Is that correct?
Yes. All right. Thank you, everyone who spoke tonight. If there are any of you who are watching who want to drop some questions in the Q&A spot, feel free. I'm going to start off with some questions that I've prepared based off of what I heard tonight. So my first question is, how do you think people can have safe and healthy social interactions during the epidemic? If we could have maybe Patrick and Samantha go.
Yeah, so well, there's a couple of ways that you can reduce your risk, right? So you'll never have no risk, but you can definitely reduce your risk. So keeping the groups smaller is a great way to reduce the risk, but also trying to hang out with the same types of people. Like if you have 5 friends that you see all the time, that is a lot lower risk than seeing a different group of 5 every single day.
And I think what we're also trying to focus on here in the more realistic approach is the harm reduction approach, which is even if you hang out with like 2 less people in any social gathering, that's still 2 less people it could be transmitting or getting infected with COVID. And I think that's also pretty important to keep in mind. Just you don't have to stop it real big right now, but just small efforts contribute to a larger picture here.
Okay, thank you. So we have one question. Let's see. I have another question about what can people living in communal spaces do if one or more of the people they live with contracts COVID-19? For example, a residence hall or a Greek chapter house.
So I can speak specifically to residence halls. If you or your roommate has COVID, they do have like isolation dorms that you can stay in. And so I think the sick person would probably go to the isolation dorm. And so that can help reduce the spread in the dorms at least. I think one of the people from Greek can talk about more communal housing in the Greek system.
I'm happy to speak for Greek chapters that have communal spaces as well. For Greek chapter, I'm sorry, it's you guys are balanced on my steering wheel as I'm stopped right now. Apologies. For our Greek chapters, number one thing that they did was that they reduced their living capacity. So normally we have between like 50 to 60 members that live in the residence halls, and now there's only about 20 to 30 that are living in, if not even less than that. Chapters had the opportunity to talk to their members if they wanted to get out of their living contracts. Well, each chapter is individually owned and operated, and how they handled the reduction of their chapter facilities is entirely up to them. Many of them opted to allow their members to get out of their housing contracts, so that way they could have less women that are living in their chapter facilities. Secondly, chapters were required to hire professional cleaning services, so that way everything was properly cleaned and sanitized every single day. They were also told to give the Center of Fraternity and Sorority Life, which is the office that oversees us, a very strict and very specific outline for how they were going to ensure the safety of their members if there was an outbreak in their chapter facility. This included the creation of an isolation space, the reduction of sleeping porches, as well as food being slightly altered for only for pickup, and that they wouldn't have communal dining spaces anymore. Masks need to be worn everywhere that isn't their individual private room, and that specific women and men have specific bathrooms that they can use throughout the chapter facility. Many chapter facilities also opted to close the semester in order to keep the safety of their students in mind. So even while some chapter facilities are remaining open, many are at reduced capacities and have implemented specific guidelines in order to adhere to the CDC as well as the governor's orders. This has been something that has been in the works since March, and something that the chapters have worked really hard on to ensure that if an outbreak were to occur, they can easily control it, and that it can keep the rest of their members that are living in the chapter facility safe.
All right, thank you for that. So now we have some questions from the Q&A tab. And so this one is, if students in the Greek chapters are trying to become the solution and not the problem of COVID-19, how come there are more cases every day? So.
Yeah, that is a great question. Why are there more cases? This happens due to the fact that many of our students are asymptomatic. They perhaps transmit COVID from people that they're seeing, and then they don't know that they're carrying the virus, and so they are passing it to other people. This is really common, and it happens throughout many different instances of how COVID is transferred. Also, this is due to the fact that we don't have a testing site on Greek Row. We don't have a way for our students to get tested. While there is a testing site at Beasley Coliseum, that's a really far ways away from Greek Row, and so many students don't have the ability to get there. Also, many of our students don't have health insurance, and so it's really hard to go get tested when there's no health insurance. Previously, students had to actually show symptoms or say that they were in contact with a person who tested positive, so this resulted in a really big outbreak on our campus. We've been asking for a testing site since March, and we really wanted all of our students to get tested before returning to campus. However, we were not given those resources from the administration. They're working really hard to get us more resources and better abilities to us. However, that was a really big problem that our students faced early on when we've been asking for that since the very beginning. So it's kind of hard to play catch up when you weren't given the proper resources to do so. Many of our students want to be the solution because they realize that they really want to return to in-person classes. Online classes are really hard and draining on mental health. They want to go back to interacting with their friends. They also, Greek students really care about their community. They're really involved in their community. We give a lot to philanthropies. We really care about Pullman. Pullman's our home, and we want to be a part of that solution. But it's hard to do so when we don't have those resources. So we continue to push administration. We continue to ask those questions. And we continue to encourage students to get tested. Also, a lot of students feel guilty if they do test positive. So then they're scared to go get tested because they don't want to bring any shame upon their chapter. We've really been working hard with chapter leadership as well as the administration to how we can reduce that guilt on students. We really want to encourage them to go get tested, as well as providing them with accurate resources. We're working with ASWSU right now to build a webpage for students on the COVID-19 tab that provide more resources to students in terms of like how to get tested, what happens if you're asymptomatic, and why you shouldn't feel guilty if you do test positive. So those are just a couple of things that we're working on and why the cases are still increasing, but we're working on being the solution and not the problem. I don't know if Jared has anything to add on that as well, but that's my opinion on the matter.
Yeah, kind of to go off of what Megan already mentioned. So part of becoming a solution is being active and going out and actually getting tested. Like she mentioned, resources to be able to get tested on campus have increased. At the start of the semester, it was very difficult for students to get tested. And that created a roadblock for a lot of our members to be able to go out and get tested, which kind of resulted in that initial spike. Now that we have more resources available on campus, often ones, like I know at Beasley Coliseum, the only thing you need to get a COVID test is your Cougar card. So there's no insurance required. There's no government issued ID required. Just your Cougar card is all that's needed. So that's allowed for the amount of tests given out to increase, which will show naturally an increase in positive cases or cases in general. But what this allows us to do then is take those people who do test positive and be able to get them isolated and in quarantine at a faster rate, which ultimately will reduce the total effect that it'll have on the community, which ends up being part of that solution.
All right, thank you both. So our next question is, it was mentioned that the school is going to announce spring semester plans this October. When will that be? And what do to people who are in Pullman you think it will be? If anyone has any answers.
Yeah, I can go ahead and take this one. So the school announced in the last COVID-19 town hall that they will make a decision on academic programming in early October. There's another university-wide town hall, I believe, next Wednesday, that will maybe shed some more light on an exact date for that announcement. I don't want to speculate on kind of what it will look like. What I will say is that cases right now aren't looking great, and we just need to be vigilant on getting tested and following some of those guidelines that we talked about earlier in the program. So you can get your COVID test at Beasley Coliseum right now, Tuesday through Saturday, or I believe Monday through Thursday or Friday behind Cougar Health Services. So there's 2 testing locations available, but I anticipate that announcement will be mid-October, early mid-October, and maybe an update on that exact date on the 30th, although I don't have any information on whether that's true or not.
Okay, thank you. This next question says, why were there still constant parties on Greek Row until just recently? It's understandable that there was a spike in cases when students came back. However, parties exacerbated the issue. What guidelines and punishments are going to be put in place to absolutely stop these from happening, regardless of legal ramifications?
Great question. So we are a self-governing community, which means that we rely heavily on our own community to report our cases. So if you do see a party that's happening on Greek Row, you can always report it at www.wsusororities.com/GSB. There's an instant report form there that is completely anonymous. Goes to our Vice President of Policy and Procedure on both the IFC and Panhellenic and MGC councils, where our students are then sent to GSB, and the chapter has a variety of different educational ramifications that are put into place. However, we cannot send individual members of an organization to GSB. We can only send the chapter, which crosses a group accountability threshold, which you can Google WSU as a definition of it. We rely heavily on chapter leadership to enforce individual people for violating COVID standards. We let chapters know when we see that, and chapters are responsible on their end for individually fining and reprimanding members. We also work really closely with Pullman PD to ensure that we have some legal ramifications for students. We work really closely with them to ensure that we have a good relationship, we know what's going on, and we can talk to civic chapters if we need to about that. We have a lot of faith in our chapter presidents on that they can deal with a lot of the issues themselves, and they do a really, really great job of that. So a lot of kudos to our chapter leadership for really being on top of that and shutting down organizations and social activities when we see that happen. For Pullman PD, they find people who are hosting the parties, and until this weekend, they can find people that are attending the parties. So starting this weekend, they can find individual attendees, but before that was not allowed. And so they could only attend hosts of parties. But we work really closely with them to ensure that we understand the scope of how social events are happening and to make sure that we can be on top of all of things that are happening. But we really rely on that report form for it, and we need it to be properly filled out in order to really see any ramifications for that. If it's really vague, we don't have any proof to show that chapter to GSB. And if it's bad enough, we will contact headquarters and make sure that their headquarters knows that they are violating COVID-19 standards. I give chapters a lot of credit for really being on top of it in the last previous weeks. It took us a little bit to learn. We're still on a learning curve too. It's a group of 20-year-olds trying to fix a huge global pandemic. So we're really appreciative of the patients that have happened in our partnership with Pullman PD. They're doing great. And so we've seen a drastic decrease in ticketing, or a drastic increase in ticketing to social events, and a decrease in social events happening on our system throughout Greek Row. And so big kudos to Pullman PD and for chapter leadership for taking care of that. But if you see anything, you can always report it on our incident report form, which is completely anonymous.
All right, thank you. So here's another really good one. How are we preserving fraternity and sorority life virtually with the pandemic going on?
Another great question. We are preserving fraternity and sorority life in a variety of different ways. One is that we're still requiring our students to meet programming and community service requirements. We didn't just throw those out the window when this pandemic happens. We still have standards that we expect our members to hold. So having community service and programming guidelines to continue to educate and make our students better is a really big way that we're preserving those values that we hold true in our organizations. Also, I'm sure Jared can speak to this about what his chapter is specifically doing, but a lot of our chapters are continuing doing everything they do just virtually. Many of our chapters have created Facebook pages and group messages to still interact with their chapters on our campus, as well as our new members that we just welcomed to campus too. So there are Facebook pages that are keeping people happy where you can send TikToks and baby pictures and recipes to still connect with your sisters and your brothers, but as well as continuing what we regularly would virtually. All of our chapter meetings are virtual, all of our programming is virtual, study hours are virtual, and community service are virtual. So we just eased that on over to a virtual platform, which has been really great. And chapters are still interacting and getting to know each other and trying to build that connection and be there for each other. Mental health is really important. So that's a really big thing that we focus on within our chapters, is to make sure that we still are preserving all of that so that Greek life can continue. We've also cut back on our budget so we don't put financial stress on chapters and individual members. That way, when things do go back to normal, we still have a great number of students who want to participate and see the value in the fraternity and sorority experience.
Yeah, and to kind of offer a little bit more of specifically what my chapter's been able to do to upkeep this sense of, normalcy and keep going with what we've been able to do as a chapter. So this situation that we're in currently with the pandemic has almost offered us a chance to return to some of the more original purposes of fraternity. So now you take the social aspect, which is what a lot of people from my chapter, as well as the community, join the Greek system for, and you put that on hold. So all of the social gatherings, all the social events, anything in person has been completely suspended. Like Megan said, everything is virtual. What this allows us to do now as a chapter is focus primarily more on education and bettering our members through personal development as well as professional development. I don't want to go on a long spiel about kind of what my chapter's programs look like. If you are interested, you're more than welcome to visit our chapter's website. It has all the information specifically breaking down our leadership and development programs. But what this opportunity does is it allows us to focus more on those educational purposes without the distractions of the social scene.
All right, thank you. So our next question is, what communication is ASWSU having with the administration about COVID and classes in the spring?
So at least for Sam and I think ASWSU doesn't really get to determine whether we're going back in the spring. We do meet with administrators and we get the message from them about what's going on. So we have weekly meetings with Cougar Health Services, different departments, different administrators. So ASWSU isn't really directly involved in that decision-making process. They might talk to Sean. I guess he would know better about that. But yeah, that's mostly an administration thing.
Yeah, I can speak to that a little bit more. So what I will say is at the end of the day, the university is going to make their decision based off of public health guidelines, and there's not much ASWSU is going to be able to do to change their minds just based on the fact that they're making their decisions on the most recent science and the best data available. What I will say, though, is ASWSU does advocate for student issues that may arise with whatever delivery we end up going with, so at the end of the day, it's not going to be myself or the ASWSU president who are going to sit down with admin and say, students want to go back on campus, let's get campus opened up. Unfortunately, that's not going to happen. What we can do as students, though, to kind of ensure that, spring's looking a little bit better is just kind of follow the advice you heard over the course of this panel. I think that, we need to show a little bit more effort in the spread of this virus. There's a give and a take here, and, we've kind of been taken. It's time to give back a little bit. So that's kind of my thoughts on that. ASWSU will continue to advocate for student services and the best experience possible within the framework that's provided based off of public health guidelines.
All right, thank you. This next question is there a way to report without being a narc? Like, so I'm gonna kind of open this one up to be a little more widespread, like not just focused to Greek community, but if you see any gatherings that violate health guidelines, is there any resource for the community as a whole to report any types of gatherings like that?
Specifically in the light of Greek life, I know Megan mentioned already, we do have an incident report form that can be filled out. And like she mentioned, it is completely anonymous. So if you don't want to, feel like it's tied to you, you don't want to feel like you're ratting out people that's a good way to do it anonymously. It's all virtual. You don't have to meet with anyone. You don't have to make a phone call. It can be done 24 hours a day, 7 days a week. As far as chapter leadership goes specifically, please do reach out if you do see something that you believe can be tied back to a chapter. I only have one set of eyes, so I can't see everything that goes on everywhere on this campus. But collectively, if we all help each other out, that adds a lot more visibility. And if we can see these issues, then we can stop these issues. So I do encourage you to keep doing that. Reach out to chapter leadership if you do see anything.
From the university side, I believe you can follow or file a violation of standards and conduct through the university. That is not anonymous though, unless it's not a required field. I'm not sure, but there is that option. University-wide, you can report issues to the conduct department.
Just to go along with what Sean was saying, you can report people even off campus if they're violating issues with the conduct board report feature. They can still be held responsible for WSU sanctions.
All right, thank you. This next question is, has it been considered to require a mandatory programming for Greek students on COVID-related risks and safety education, similar to trainings which university employees have had to complete?
Great question. Our community is really based on education and really making sure that our members have the correct resources. This has been a thought, and it takes a lot of work to plan a programming. Our programming vice presidents work really hard to ensure that we have really great educational programmings that match the issues that our community is facing. We have a ton of information on our website. If you go to the WSU sororities, fraternities, or MGC website, a ton of information can be found there. It's also all over our social media. The reason why we haven't had an educational programming about this yet is because we're working to try to find a health public official that is willing to come and speak to our Greek community that's within our reasonable budget. They're really busy and have a lot of time that they're working on to ensure that cases in our Greek community don't increase. And so we're working really hard to try to educate our community the best that we can while we continue to wait for a health professional that can speak to our community from a professional lens and not be swayed one way or the other. We work really hard to have unbiased type of speakers so that we are getting the most accurate information to our community. We, however, also worked really hard with our chapter leadership to give COVID-19 resources to them that they can share with their members. We created a COVID-19 kind of like guidebook over the summer that we shared with chapter leadership that can also be found on our website. That was shared in case anything were to happen. What do symptoms look like? We send emails all the time to chapter leadership about that as well. We really rely on chapter leadership to kind of amplify certain messages. We can only have so many people attend programming at a time. And so we provide a variety of different programming activities throughout the semester. However, it's really hard to require all of our Greek community students that are thousands and thousands of people that juggle jobs and different schedules and different class sizes and labs. And we really want to make sure that their academics is the number one thing that they focus on, as well as their individual health and safety. And so we work on communicating COVID-19 resources to them via their chapter presidents, via our website, via social media, so we can really reach the most number of students that we possibly can for COVID-19 resources. We also rely heavily on the administration to deliver those types of resources, and it's a little bit above us in terms of our expertise. So we really want to make sure that we're listening to health officials and the CDC and Whitman County when we are talking about COVID-19. It's not coming directly from our office, but coming from a place that's a little bit more higher up and a little bit more official.
Yeah, and to continue on with what Megan said, while we're waiting for a programming to be put out, by university officials or CFSL office workers or anyone that's above chapter leadership directly. Individual chapters should be encouraging their members to get educated on this subject or host like an in-house programming where it's just your specific chapter and you can offer those information, offer the information and education that was provided to chapter leadership by the CFSL office over the summer to your members, like Megan had said. Every sort of educational opportunity that we can offer, we should be offering to our members, especially something about something like this that is a public health emergency.
All right, thank you. This next question is, how are you all holding yourselves and your friends accountable for their behavior around COVID?
At least for me, one thing that you can do, regardless of if you're in a leadership position in your chapter, in your community or not, is to lead by example. So if your friends are encouraging you to go out or break guidelines or do something that you feel uncomfortable with or unsafe doing, be that first voice that says, hey, look, I don't feel comfortable doing this. This isn't right. I'm going to hold myself accountable. I hope that you do too. And if you do that with yourself, if you're holding yourself accountable to those standards, hopefully your friends will be able to see that good example and replicate the actions that you are producing.
Something that we're doing to encourage our friends and the members of our Greek community as well is just like Jared said, stay educated. We want to make sure that we always have the most up-to-date information, but also we're really encouraging everybody that we know and that we're friends with to go get tested regularly, make it part of your weekly routine. Just like you go to the grocery store, go get tested for COVID. We're really trying to encourage testing and make students not feel guilty if they do test positive. And so if we have a friend that tests positive, we're trying to be there for them emotionally and really be there for them so that way they know it's okay, and ask them if they need anything. Can we go get groceries for them? Just trying to be that helpful person to them as well. We're also working on trying to understand what does quarantining look like. You have to quarantine after you get tested, so that way in case you do test positive that you're not exposing yourself to more people. And so one thing that we really try to stress with our friends is one, that it's okay, go get tested, and if you do test positive, that's totally okay too. And two, that it's really important to quarantine and that we can have FaceTimes or we can Snapchat or connect over social media if something does happen. And so that's something that my friends and I are doing to try to support each other through this too.
Awesome. I know for myself, if my friends will text me and say, do you want to go to a restaurant? I'll check myself and I'll stay home, and I'll say, it's not worth it for me to possibly spread this disease to someone else who's going to be more vulnerable to it. So I'll tell them, I'll see you another time, but right now is not the time to hang out with anyone and everyone. All right, well, thank you all for attending our COVID-19 panel by students and for students. Thank you to everyone who submitted questions, and thank you to all of our panelists for being here to answer questions and talk about how we can help slow the spread. Have a good night, everyone.